All right. Good morning, everyone. My name is Jessica Fern. I am the Director of Global Health Impact here at CanWaCH, and I'm very excited to welcome you to today's very special conversation, 365 Days of a Pandemic, Virtual Practice Implications for Canadian Partners. Today, of course, marks the one-year milestone since COVID-19 was declared a pandemic by the WHO, and it has been an incredible year of learning and challenge and growth for all of us. And so, as I'll speak about in a moment, today's conversation will be a chance for us to really talk about and really zone in on this question of monitoring and evaluation in a virtual context and what this has meant for Canadian partners and where our pathways forward are. For those of you that have just joined us, we do have simultaneous translation available for today's webinar. You can access it via the instructions here. If at any point you get disconnected or you're having any problems, please contact my colleague, Tina La Rochelle, in tech support. In the chat, you can write to her directly, and she is happy to assist you. As well, as always, we encourage folks to ask any questions that they have, to write them in the chat, and you can do so in the language of your choice. We will ask them out loud in that language, and the participants, our speakers today, can respond as they wish. So we're going to get going because as I was chatting with some of our presenters, our panelists today, and we already are unsure about our ability to cover all the things we want to cover today in an hour, but we'll do our best. So I'm going to kick us off with some just basic preliminary remarks. We will then invite our colleague, Tanya Trevors from Global Affairs Canada, to share some thoughts and insights from her perspective. And then we will dive into a conversation with 4 members of the CanWaCH working group who've agreed to share their thoughts, reflections, and descriptions of challenges and solutions that they're working with. And you can see their names up here. We have Bart Dickinson from the Primates World Relief and Development Fund. We have Jakob Nemec from Salanga, Dr. Jen Brenner from the University of Calgary, and Louis Basil from Canadian Red Cross. Welcome to the 4 of you, or 5 of you with Tanya as well. We're so excited to have you. And we know that we're only going to be able to touch on just a few pieces of all the things that we'd like to discuss today. So please know that this is not the only conversation that we plan to have. Throughout, I'll be asking folks to share in the chat any resources, questions that they have, and we hope to make this an ongoing discussion to really dive deep into some of the meaty issues that we need to tackle in the next 365 days to come. So very briefly, in June of 2020, CanWaCH released this report, 100 Days of a Pandemic, Canada's Evidence-Driven Global Response. This was, as the name suggests, a report that captured the initial ideas and challenges, concerns that were emerging from Canadian organizations and their partners shortly after COVID was declared a pandemic. And we really focused in this report on evidence and on the role of data and challenges relating to virtual monitoring and evaluation. And when we did that report, we heard a whole host of things that were considerations, top of mind, things that folks were thinking about. And we can share, if you'd like, the webinar that we did at that time, where we explored some of these challenges so you can see them in a bit more detail. We can also share in the chat the link to the digital report. But basically, some of these key issues, were very top of mind. And so at CanWaCH, we've basically been trying to keep our finger on the pulse of these issues, following them, consulting with our members and members of the Metrics Working Group specifically to get a sense of where considerations are, what's changing, and where additional support is still needed. The other thing that we have done is continued using our Project Explorer to try to get a bit of a sense of who's doing what. And of course, this is very difficult to do because we are still at the point where, some things are coming out that are COVID specific, but of course, COVID response is integrated into everything that folks are doing. And we know that we have a bit of a ways to go before we capture all of the data, or at least a good majority of the data, in a meaningful way. But what we do know, based on some of the work that we've been able to find, is we have at least 52 projects reporting to us with a specific focus on COVID-19 response. And those projects are occurring within at least 59 different countries. Again, likely these numbers are much higher. And we have 37 organizations sharing that data with us, of which 26 are specifically Canadian partners involved in leading the response. So what we take from this, knowing that this is only a fraction of what is occurring, that this is a very significant and growing topic of consideration. What I didn't include there, but which we are capturing, is the duration of these projects, and recognizing that projects are already thinking about what this is going to mean for long-term changes to their objectives, and how they'll measure their work. And our colleagues will talk a bit more about that. Just so that we all know where we're talking about, we continued to see, of course, that health promotion, WASH support is kind of the key areas where folks are responding. But these other areas of education, policy, nutrition, reproductive health and rights, among others, these are other topic areas where there is still an explicit COVID-19 focus. So we are seeing organizations, again, no surprise, continuing to think about the implications of this in a wide cross-section of areas and a wide range of deliverables, in addition to very specific target COVID-19 response. And so throughout the past 365 days, these are some of the things that we have been hearing. We've been hearing questions and concerns around how to balance this issue of good enough data. What is good enough data? What are good enough data collection methodologies? Recognizing that there are long-term consequences to these choices, and that we will potentially have to live with the consequences of this data for a long period of time. We're going to talk about the issue of large data sets and the challenges that folks are seeing around unreliability or concerns around unreliability of those sets. Qualitative data in particular, and how to capture context and nuance in a virtual context remains a challenge, as well as the broader question of how do you talk meaningfully about impact when a project's orientation perhaps is fundamentally changed. We've seen comments around the need for, in reporting to funders, the need for really clear information on if proxy measures are used, if there's been changes to sampling size, if you've revised targets, making sure that those processes are transparent, but that can be difficult to document with so much continuing to shift and change, even when you're in, especially as new variants of COVID may arrive in the communities where we work. And then finally, that data sharing and virtual collaborative approaches are a priority. Folks are continue to be interested in really prioritizing, thinking how we can work together in a way that perhaps was not as much of a priority for individual organizations previously. At CanWaCH specifically, we've heard from our members and partners that these are kind of key areas where we can provide some support. There's a need for support in capacity building and thinking about and sharing information on creative strategies that we can use. To the data sharing point, continuing to leverage the Project Explorer to gather more data so that we know who is where, and that's a priority for us in the coming months. And then this kind of last piece, facilitating ongoing conversation and networking with sector leaders who have a lot of expertise or who are doing a lot of thinking about the challenges in virtual monitoring, is something that folks are looking for, and that's why we're here today. So the four individuals that I mentioned come from these different organizations represented here, who are members of the CanWaCH Metrics Working Group. And of course, Global Affairs Canada is also a member of our Metrics Working Group. So you can see that we have individuals representing 17 different organizations and institutions. We have academia, we have CSO, we have social enterprise members, all who bring different perspectives and insights. And we meet monthly to discuss technical issues relating to data monitoring and evaluation. And in this context, touching on their expertise to share implications for sector practice. So it's a great group. And so we've invited our colleagues today to reflect on these kind of four broad questions. Don't worry, because I'll ask them out loud. But I just want to leave you with the general categories of things that we'll be exploring today. We'll be talking about large-scale data sets and how we work with them. We're talking about how we think about and measure impact, implications, particular around context and qualitative measurement, and some general best practices or cautionary tales to share. We'll do our best to get to all of these questions, and those that we don't, I think, will be conversations for future discussions. But if you have additional questions that you'd like to see explored, as I said, please don't hesitate to enter them into the chat. So that is all that from me. What I'd like to do now is invite Tanya Trevors from Global Affairs to say a few words from her perspective before we dive into some of those questions. Tanya, over to you.
Great. Good morning, everyone, and thank you to CanWaCH and especially to Jessica for inviting us to be part of this interactive webinar today. Marking the 1-year anniversary of COVID. It kind of sits heavy today. I know within Global Affairs, we're taking a half an hour this afternoon just to pause and reflect on the year. And I think that's valuable for us all to do today. I'll just reiterate, I'll be speaking in English this morning, but I do speak French. So if there are questions, I would be pleased to receive and answer them in either language. Bonjour à tous, merci à CanCEF et plus particulièrement à Jessica de nous avoir invités à participer à cette discussion interactive en ligne. Je m'exprimerai en anglais ce matin, mais je parle aussi le français. Alors, s'il y a des questions, je serai heureux de les recevoir et d'y répondre dans l'une ou l'autre langue. So, Jessica, are you going to ask me the questions, or should I just use the questions that you've given me?
You can just go ahead and say whatever you'd like to say, and then I can always follow up if we think we need to hear even more.
Okay. Well, the first question that Jessica and I discussed a few weeks back was about what are the questions that Global Affairs has in regards to virtual monitoring and evaluation practices during the COVID pandemic. And this was a good question for us to reflect on. We know that our partners are continuing to adjust their M&E plans for many reasons, most particularly due to the lockdowns and restrictions to movement that are still ongoing in many countries. For many of our partners, what we've heard is that this has meant switching over to using remote rather than in-person data collection methods and for information dissemination, placing different emphasis on qualitative data approaches, delaying or adjusting protocols for baseline and end-line surveys, and also looking for and finding additional in-country M&E expertise that some organizations didn't have easily on hand prior to the pandemic. As we at Global Affairs too, we're thinking ahead to the upcoming reporting season, as I'm sure many of our partners are as well. We want to know if and how these adjustments to your M&E plans are going to impact the availability and quality of the data that you're going to be providing in your reports. We recognize that there's going to be difficulties and constraints, and we look forward to hearing how you've adjusted within your reports in the section where you're able to comment on the individual data points. Some of the questions we have, and Jessica touched on these as well, is that, is it going to be possible to collect data on all of the planned indicators in your PMFs in line with the reporting schedule? And if not, we encourage partners to really reach out to their PTLs and communicate any concerns or mitigation strategies and gaps that are expected, and to be as proactive as you can in that regard. Another question we have is, is the data going to be reliable enough? Jen Brenner and I just had a great conversation this morning with her team in Uganda, talking about HMIS data and the challenges we know that are facing the government data collections systems during the pandemic. So what are the other alternative approaches? And I think we'll hear more from the partners later on in the seminar today about some really good concrete examples. Another question we have is, will the relevant information collected be owned and used and useful by the project participants? I know, Jakob, this is a big piece of Salanga's work, is to look at participatory approaches to data collection, analysis, and use. And I think, and you've heard this from the department, and we're hearing it from all of our partners, is about localized approaches. And the pandemic really gives us this opportunity to rethink how we're doing monitoring and evaluation, and to really build from the bottom up. Another question I have here is about what the risks are to CSOs and to project participants in conducting and participating in adjusted M&E activities. We know that there are protocols in place. There's still risks, very significant ones with regards to COVID, and the vaccines are still slowly rolling out, but we still have a long ways to go in that regard. So we want to make sure that our M&E activities are also not causing harm to either the people involved in collecting the data or to the participants. Using the principle of kind of do no harm. We know that digital data collection is more convenient for many people, but it will inherently leave those who don't have access to tech or to affordable internet behind. This can also lead to increased marginalization and kind of warp the view of what's happening in countries. Discussing sensitive issues over third-party platforms and in-home settings may increase risks to privacy, and partners need to be sensitive to about how we can be protecting personal information as much as possible. Again, I know we're all thinking of this, and right now we don't necessarily have all the safeguards in place, so it's something that we need to keep top of mind. The second question that Jessica and I discussed was about some examples of practice that have already yielded some strong results or positive examples during the pandemic. I reached out to a colleague in our evaluation team, and they were referring to a recent evaluation that was carried out on gender equality programming in the Middle East and the Maghreb during the height of the pandemic. And that evaluation was done using remote and digital data collection. And they felt that the best practices around safeguarding privacy and protection in the case of the remote and digital data collection was applied in line with Canadian privacy law and international protection standards. So, you know, that's, I think, a positive example. And if others are interested in sort of looking at that as an example, I'm sure that our evaluation team would be happy to share some examples. I see someone with a child on the screen. It's great to see. Another point we wanted to raise in terms of, I guess, a good practice example was that many of our PSM-NCH projects were in the process of carrying out end-line surveys just as the pandemic started. And those are our PSM-NCH partners on this call. Like, they all know they were in the middle of it. Some of them were not able to complete all of the survey work that they had planned to do, or they had to adjust kind of mid-course to enable the social distancing requirements that were put in place very suddenly. I think a positive is that we really appreciated how frank the partners were in their assessments of what data was possible to collect and what wasn't, and that the priority remained on the principle of do no harm. And in reviewing the final evaluations that we have seen, we've been very impressed with the quality, and you know, where the data was not as comparable or comparable at all to the baseline. We were just pleased to see that those explanations and justifications were provided. So the other point I wanted to mention here is around participatory research, and this kind of goes back to the sort of community-owned and led approach. And I think there's a lot of value here in looking at action-based researchers and practitioners with experience in participatory approaches in countries, to enable a dynamic conversation about how communities and health workers are adjusting in the context of the pandemic, and also how they're adjusting to using virtual methods of service delivery, and also methods of data collection. We know that even more than ever, knowing and understanding the local language and customs is of utmost importance, because we're relying less on body language and sort of face-to-face interaction, and that often really changes the quality of the services that we're trying to provide, as well. And when it comes to monitoring and evaluation, it impacts sometimes the quality of the data that we're collecting, particularly for qualitative purposes. So to close, the last question that Jessica and I talked about was looking forward to our upcoming commitments. Where do we need to focus to strengthen our capacity? And I'm just going to put out a few questions here that I think Lue and Jen and the others, Jakob, will be speaking to in their presentations. We'd like to understand and hear more from our partners in terms of what is the capacity of our partners in country and local CSO and government partners when it comes to results-based management, and more specifically with understanding global affairs expectations for reporting. We know that the CSOs in Canada often perform that function of interpreting what global affairs wants with their local partners, and there's a lot of capacity that perhaps needs to be developed to simplify and just make clear what global affairs is looking for. We also want to understand, where does global affairs need to adjust our own reporting expectations given the current realities of COVID-19? And we have heard some of those through the partner dialogues that we hosted in November and December. We want to know how we can be more proactive to avoid situations where partners provide the no data available due to the COVID-19 situation in their reports, without having discussed or explained what the mitigation strategy. So that's kind of, we'd rather hear upfront from the partners about why certain data was not collectible and what the alternative approach was, rather than just seeing a line, no data or NA. We'd like to understand how partners are reaching out for assistance and supporting each other to explore alternative data collection methods and sources. And I think that's a great area where CanWaCH can play a role, just to help sharing of those best practices. We want to avoid repeating mistakes, obviously, and the sharing of lessons learned is a great way to get there. So those are some of the questions that we wanted to put out to the partners, and we found the partners so far to be very proactive in reaching out to us and sharing some of the constraints that they're facing. We're learning as well during this process, and I look forward to sharing the other presentations today as well. Thanks, Jessica.
Thank you so much, Tanya. Those are some great questions. So let's dive right in to them. And you alluded to chatting a bit with Jen this morning about HMIS, so I think that's a great place to start. So Jen, I'll maybe ask you the first question, and you're invited to share your thoughts about how COVID-19 has affected the quality and the reliability of the HMIS or other large-scale data sets, and how do we think about navigating these challenges?
Yeah, thanks, Jessica, and thanks to Tanya and GAC for their openness and conversations around this subject, because we've found some really interesting trends as we've been working with HMIS data that's incoming during and prior to COVID-19, especially in Uganda, where we're just starting up a new project. And I have to put it out there, I'm actually a really big fan of HMIS data, because I think it's really critical that we invest in using data in our project reporting that is also relevant to our partners. And for most of the settings we're working in, HMIS is the core for their own internal system reporting. So I'm a really big fan of using HMIS and tracking it, both for building capacity and then also for using it as a progress indicator on projects. However, I would say that we're in a really unique setting right now, and I think we have to be really super cautious about how we both interpret the data that is coming out from HMIS indicators and also attribution. So it's kind of critical to note that the setting is going to be different for HMIS, in all sorts of different places. And COVID-19, and particularly the implications of the public health measures, have just swung everything in healthcare, both service and demand, upside down. So there are so many factors that we are not really understanding and that are constantly shifting. So I think some of the dramatic shifts that we've seen in social family health factors impact greatly the HMIS indicators that we're used to just sort of taking as, noting trends that go along. And there's a couple of reasons for this. One is that some of them have just dramatically changed, like especially whether it's service side or demand side indicators. People, there's been health facilities that are completely closed, or where they've had to shut down their services, or where we know that people can't go to seek services because all the public transportation in the whole country has been shut down. So we have to recognize that that's a major, major factor for this period of time that we've been going through, that has affected both the ability of health providers to provide services, and then also for people to get there. There's been other things that, if we're looking at surveillance data, that we're going to see both in the short term and long term, social factors that have dramatically shifted the rates of teenage pregnancy, the rates of gender-based violence, mental health, and STIs and HIV/AIDS. Some of those will be apparent right away, and others are going to be lagging indicators. So those are things that are really outside, in my perspective, outside of a project, and very much a factor of what's happening much more largely. I also think we have to consider that HMIS reporting may not have been very regular over this period for lots of reasons. Maybe data clerks didn't show up at facilities. Maybe services were offered virtually instead of in person, and that the reporting depends on a certain process that's no longer in place. Or maybe it just hasn't been a priority. Maybe the reporting has increased. So there are going to be factors like that come into play. And these are not just now, but as we go forward, like once we start to vaccinate people for, where's that going to fit into the register? There's going to be more people seeking care because now they're coming for vaccination. So there's all these factors that come into play. But one of the most interesting things that we've seen in our setting in Uganda has actually been a change in denominator. And that's something that HMIS is not very good at taking into account unless you look at HMIS across a country level. So we have seen in Uganda, where we're working, because of the shutdowns of schools and of largely businesses in urban settings, a massive, massive migration to some of the target communities where we're running programs in rural communities. And I mean, this is especially prominent in the adolescent and youth age group. And so that is going to dramatically affect, I think, how we interpret the data. So all of a sudden, there's almost doubling or maybe even more of the population in those communities, which has actually increased a lot of the HMIS data for this short period of time, while at the same time, other service numbers have decreased. So I think we really just have to understand that interpreting this data is not going to be straightforward, especially if we're trying to do analysis at the district level. And I think it's very important that while we track it and try to understand these trends, we don't project our project progress strictly on HMIS. And I think that's something that GAC and our conversations with our GAC colleagues is going to need to take into account from a project perspective. And this is not unique in the low-income country setting. It's also happening here in Canada. Yesterday there was a report released that there were 14,000 excess deaths in Canada in 2020, and we still don't understand where those came from either. So these are very, very complicated for us to understand. So I think HMIS needs to be considered very carefully as we go forward.
Thank you, Jen. Great thoughts. Louis, did you want to come in on this and share any reactions?
Yes, thank you. Yes, I mean, it's great to hear Jen talking about how she's enthusiastic about HMIS. We did in our Mali PS MNCH project work on supporting HMIS system in Mali. The country moved to DHIS2, which is an online platform that allows capturing of data at the lowest facility level, in fact, down to the community level, if you have CHWs there, community health workers. So our objective was to how to support at the district level a completion of data, because we noticed that data is not completed, entered fully by all facilities in the system, which caused a lot of problems. And since we are working with community health workers, and their data is part of the HMIS. We selected 10 indicators that of the same services provision from this facility and from the community health workers, so that at least district health department will see, let's say, treatment of malaria cases for children under 5, provision of certain type of contraceptives that the CHW provide and the SISCOM and the health facility provides, and so forth. There were 10 as a sample. And we looked to the baseline on the completion of data, and we provided support throughout the project on how to improve even the data quality and not only the completion. And the results were kind of really very good. People were willing to work as long as there is support. And the objective of the project at the time when we designed the PS-MNCH was to give an idea to the district health department, because the provision of service largely coming from district hospital, clinics, and community health workers. If we get all that correct for an indicator, they can have a good idea about the coverage of service. And that would help them in supply chain of commodities, putting human resources in facilities, because the rest of the service provision is going to come from less sources, which is private clinics, people who go directly to pharmacies to self-medicate, or to go to traditional healers. And there are external sources like our baseline and DHS that gives an idea of that, that kind of provision. So the bulk of it comes from facilities and community health workers. And by having that picture to the to the district, it was, I think, useful. Now we run into some problems under the quality, because rural maternity homes in Mali is something recognized by the Ministry of Health, but their data is not captured, and a lot of deliveries happen in them. So between those who deliver at home and those who deliver in health facilities, quite a bit deliver in the middle, which is a rural, they call it rural maternity homes. So no formal data collection, no formal reporting. And we managed to create a formal reporting with the Ministry of Health, with the local partners, with our partner, the Malian Red Cross. So I think there is quite a potential for that, especially in the time of pandemic. If we manage to get, we tried to get HMIS data of 2016, compare it with 2020. It didn't work for a number of reasons. Incompletion from 2016, they were using the former paper plus Excel platform as opposed to DHIS2. But if we have, let's say, a new project, the lesson is that it's better to start right from the beginning, at least to help facilities complete certain indicators.
Thank you, Louis. That's a really helpful, specific example. I'd love to unpack even a little bit more about that experience. But I want to bring Bart in. Bart, any reactions to this, or from the PWRDF perspective?
Yeah, I mean, I think the question, how has COVID-19 affected the quality and reliability of HMIS data? I mean, long before the pandemic even came about, the quality and reliability of HMIS data was highly subjective, and really, I mean, that's what steered a lot of people away from looking at it or using it, I think. It provided a disincentive. What COVID-19 actually does is it forces people to familiarize themselves with HMIS. I think you got a lot of practitioners now in the sector who are now really looking at the fundamental gaps, inconsistencies in HMIS data, and really looking at how they can improve those. So I think this really kind of lends to a discussion of how we can improve a sort of more systematic approach for HMIS, because it varies, as Louis was mentioning, varies country to country. It varies urban to rural. It varies private sector to public. And it's really difficult when you're planning a project at onset, like, for example, a multi-country project like the one that PWRDF currently operates with GAC, to have kind of consistency in the quality of data and come up with indicators that would be globally applied to all of those partners. So rather than being able to say, the quality of HMIS data is suspect and therefore we're going to use primary data instead, it's really forcing us to look at the consistency and regularity of HMIS reporting, the training of staff, the decentralization of training of staff in rural areas, the digitization of records, collaboration between private sector and public, And the process, like the very process of navigating this shift, has given practitioners and analysts a better understanding and familiarity with HMIS, which I think is a positive. Obviously, it's a challenging time, but I think bodes well as we look forward to improving M&E systems as an actual outcome of a lot of development programming.
That's a great point, and definitely echoes what we've been hearing, as I mentioned at the outset, a significant interest from we've heard in the sector about learning more about the challenges and how to leverage existing data more so in their work from organizations that perhaps previously hadn't done so. And so I think that's something we'll definitely want to explore a bit more. But building on this, we also talked a little bit about, just more widely, and this comes to the question that Tanya asked about, measuring impact and how COVID-19 has brought about some fundamental shifts in how we think about and measure impact. A big part of that too is in the approaches that we use. So Jakob, bringing you in here, and Tanya alluded to the participatory approaches that Salanga has always championed. Would you like to share your thoughts on how COVID has changed how you and Salanga's partners are thinking about and measuring impact now in this context?
Thank you, Jessica. I would like to pick up what Tanya mentioned about seeing the shift to the localized MEL. And that's something it's a shift that I couldn't even imagine was possible a year ago to the scale that we've seen over the years. So not only that we have seen local colleagues who had no experience with MEL being able to pick up some of the MEL tasks and carry on, whether it's collecting data, whether it's analyzing or engaging with different stakeholders. But we also seen unbelievable shift in who makes the decisions around the tools, around the processes that we have. Because commonly in the past, the decisions were taken by people who usually didn't know. And only now we realize that only people who really were on the ground and had hands dirty with the field work actually could make the decisions on whether we can go to the community, what is the most appropriate tool. And so it kind of shows us that we probably based a lot of our decisions in ML in past based on assumptions done by people who had not such a great idea about what's happening. And we do see amazing uptake of the communities taking part of this. We hear that a lot of partners had a trouble collecting big, large surveys. So I would like to plant in your idea, imagine it doesn't need to be a large survey. We can instead run hundreds of tiny little surveys in each community that are not managed from one area, that are not managed from one consultancy firm or whoever body MEL officer, but that are managed by the communities. And that's the shift that we actually do see, and we would like to see it even more in the way that maybe we don't necessarily look at the impact of the project, but we do look as a whole, but we do look at the impact of the project in each of these pockets, and then try to figure out on our end how we can bring this, these few, the many impacts together on the large scale. So I think it's a change in the shift of, we cannot, of course, shift away from completely standardized indicators and the approach, because there is a huge value in it, but we can open the doors for maybe alternative approach to this, and that's the community-led initiatives. But also Tanya asked, what is the capacity of the partners on the ground to absorb this? And I would say there is an even more pressing question. What is our capacity and ability to sit back and leave the power to somebody else? And that comes from the donor department or the donor environment, that comes from the implementing organizations in Canada, because it comes also with the accountability. So if we figure out how we can do the step back and sort of provide the support that is really needed by the colleagues on the ground, that they can figure it out and they can really bring on board the communities, we can probably overcome even worse conditions than the pandemic and the lack of access. That is a really critical piece, and we also heard that going virtual, there's a high risk that we can leave behind somebody who doesn't have access to that virtual environment, and we can put in place more barriers. The community aspect may have the same aspect. For example, in Myanmar, we we preloaded like a devices. We just completed the data collection before the coup happened, and we preloaded devices with like all the onboarding with the survey, and then we shipped them to the communities. Very local grassroots organizations conducted those kind of like hundreds of surveys in each community. And then we analyzed the data back, looking were they actually able and successfully reaching out to people who are completely outside of the like a mainstream. And we did see that there is a huge difference in who these sort of carriers of the services are. And if we reach out to, let's say, grassroots women organizations that are really passionate about the work they do, we definitely see that they can do the work and they can reach out to the ones that are most vulnerable. And then my last point on this, when we talk about impact, for us, the main measure over the past year about the impact of different activities and different projects was we really looked at the activities that were sustained during the COVID time. And some of them couldn't be sustained because of the nature and the nature of the restrictions. But a lot of them weren't sustained by choice because people focused on something that they found really important. So especially in MEL, we have seen a lot of activities in measuring and monitoring were dropped by the project teams because they didn't find them important. But we did see a lot of the activities sustained. And that's to us a huge indication of the impact, on the programmatic side, but also on the MEL side, like which activities were sustained and why the team decided to keep them and carry on. So that's something for us to sort of look into the impact and be able to measure it.
Thank you, Jakob. Jen, I saw some nodding over your way. Would you like to come in on this?
Yeah, thanks. I couldn't agree more with Jakob on all the points, his main points. Firstly, that I think this whole experience has reminded us that, you know, life and health, and it's not all black and white. In the metrics world, we can sometimes try to put things into boxes, and we've got our methodologies, but I think really there's a huge amount of richness that comes from using mixed methods. And for us as well, we've experimented with a lot more, what I would say are participatory rural appraisal kind of approaches and tried to integrate those. And I think it tells a much, much better story. The challenge is fitting them onto a PMF. And we've had conversations, and I'm thankful again for the Global Affairs team for working with us on that. But I think that's really where the story comes in. I also really, really believe in the concept of localization and having local strong teams. In our case, we're very fortunate that that actually has been a core component of our project. So we have not slowed down whatsoever during this time because of challenges getting into the country. I think maybe there has been more room for our in-country teams to really run with things and try new ways of doing business and take on roles we maybe haven't had the opportunity to do, but generally having that capacity in country is amazing. And those people are there in every country where we work. There are people who are very, very capable of designing, developing, managing, and analyzing. And so I think that has been reinforced and is a great reminder for all of us. And then I also agree that I think what has shown through during the pandemic for initiatives that have taken place over the last few years is really the importance of the health system strengthening piece here, and how where you invest in health systems, in projects and in programs and in initiatives, there really is the capacity for organizations and groups to pivot. So the places where I think that's a sign of impact, that we, you don't measure that at the end of the project and say, wow, they've really been able to respond well in this very challenging time. But we have seen that in communities where there's been an investment in health system strengthening, they've been able to pivot during COVID-19 and apply their skills and talents to this difficult situation. And that should be like a way to really report back on impact. And unfortunately, most of those projects are finished, but those are the types of things we should be looking more at.
Great. Louay, you started us off with a specific example of some of CRC's work. And so I know that this is something that you're thinking about a lot, participatory approaches, but certainly at the scale at which CRC operates. What are your thoughts on this?
Well, it was a big disappointment back in March when we realized we were not able to do the coverage survey at the end line after months of planning. And the alternative approach after looking at research was that assessing the quality of implementation. So the theory is that if we assess, and the more the implementation is of a quality in terms of reach, quality of service, type of messaging, the frequency, the timing, the quality of training, the supervision, the evidence behind that. If you put all that together from existing data sources, and if you want to have some primary other than coverage survey, you could have an idea about the impact. So we embarked on that, and we used all the existing data that we had. Monitoring data we were using from the Ministry of Health system, which is quite advanced in Mali, and we put quite a bit of money in it through 4 years of implementation, all digitized. Supervision system from the Ministry of Health data that we used. At midterm, the RADAR project of Johns Hopkins did 2 assessments of the quality of care and implementation trends for integrated community case management that we used. We compared it with supervision data at the end. We used evaluations done by our partners, Menengage Alliance, working with religious leaders, acted working on income generation to help community organizations continue funding CHW positions after the project comes to an end. That was on a pilot basis. And we realized that we still need a little bit of more primary data. So we are not going to do coverage survey and go to 3,000 households like we sampled in the baseline. But we felt that, and after consulting with the partners on the ground, it's possible to talk to our 440 CHWs and have a quantitative data collection from them in a survey that has multiple modules, because we could control for COVID prevention measures. We were interviewing one person in an open space and a protected environment. That was done with using digital mobile devices. And with the help of our partners at SickKids, we produced a report that triangulates all those data together. So when we are assessing, let's say, the impact on family planning, where did the dose come from, the frequency, the quality, and the evidence of that. And you see that data was coming from, and we tried to triangulate with HMIS, which is unfortunately that didn't help, but we had enough to come up with a narrative, to come up with an idea, and it would give us an idea. So for example, the reach we know from our data was that CHWs reach to men and women on family planning. But we wanted to know more. So through our survey, we asked, did you reach to adolescent boys and girls? Because the data system of the Ministry of Health doesn't give us that. If the answer is yes, did you reach to married or only single adolescent boys and girls? Did you reach to religious leaders, community elders? Those are the gatekeepers who could be facilitators or could hinder any change in attitude. And when we put all that together, then we can have an idea about the quality of, or what we expect from changing attitude and behavior in terms of family planning. We are going to do qualitative data remotely. We're in the process of that. And then finally, we will have a set of consultants who are going to look into the meta review of all of this and come up with some findings and conclusions. We won't be able to quantify the impact like in the PMF, but this methodology will give us an idea about the potential and the quality of impact that we can have by providing the evidence in a quantitative manner on the dose and the quality of how it was implemented.
Thank you, Louay. I'm looking at the time, and I want to make sure that we have a chance to kind of talk a little bit about kind of the broader, lessons learned, best practices, cautionary tales, but also to touch a little bit on this question of qualitative and context, which we've heard about quite a bit. So maybe what I'll do is combine these next kind of 2 questions and invite the speakers to share what they would like. Either talking a little bit about, the broader best practices, lessons learned, and the implications for virtual monitoring practice, or if they would like more specifically to talk a little bit about the qualitative piece and how that is shifting in a virtual context. So Bart, can we start off with you for your thoughts and reflections and what you're looking at?
Yeah, I mean, there's a lot there. I mean, when I think about best practices and lessons learned, I mean, number one is the importance of investing in HMIS and M&E systems. That improved M&E in of itself should be an outcome for a lot of our programming, and that improving those only bodes well for like our own selves, but empowers our partners and partner countries to make evidence-based decisions moving forward. It's really a sustainable impact that continues to deliver. I mean, I remember kind of last year, there was fateful words when I was hounding someone to give me some data, and he told me, it's not like the world's going to end. And I mean, I don't think we need to be doomsday prophesizing, but when we look at risk registers at project inception, we need to really be building in the risk of a dearth of data or a lack of access to data, which was a challenge before even COVID-19 happened. But it's something we need to plan for, and whether that leads to a discussion of, do we want to create proxy indicators? Do our risk registers actually properly account for this kind of change? I think that's important. Also the change to going digital. I remember it's only like 10 years ago, we talked about, digital data collection as being an innovation. It's really the normative standard, and we need to look closer at sort of the ethical ramifications of collecting data remotely, what that means. And Tanya, you touched on it perfectly earlier. Like when we're talking about the FIAP and measuring, transformative changes, challenging deeply entrenched cultural norms about gender, sexuality, sexual autonomy, you really need to create safe spaces for people to be able to communicate that information. And it's much more difficult to effectively control or oversee that in a remote setting. So I think it's really important that we account for that and that we are safeguarding the participants in this process. When it comes to quality data, I've got a lot of qualitative data. I don't think that the PMF and the tools that we use to report on qualitative data are good vehicles for communicating qualitative data. And for all the rhetoric about the importance that they're sort of on the same level, we are asked to quantify our qualitative data frequently because you want to see like a high enough sample size effectively to validate the qualitative inference. And it's really challenging to communicate that in like a box when you have a multi-country project and a tiny amount of space. So yeah, I'll stop there.
Well, that's definitely something for us to explore. And in fact, I'd like to invite folks as we're coming up to time, as some of the ideas that have come out, if there's some that you'd really like to see us explore in more depth, and that you'd like to be a part of those conversations, please write it in the chat so we know kind of what to prioritize and what's of greatest interest and need for you, and we can plan our future conversations accordingly. But Jakob, I saw some vigorous nodding on your end as Bart was chatting. Please chime in.
I could every time nod to Bart's comments because I love his like openness to say things how they are. Two things: qualitative data. I would love to see the design of how we capture the qualitative data and their analysis to be brought much closer to the folks on the ground. Like what we commonly see, we design amazing tools for capturing observations and focus groups and all that. We collect all this like huge piles of data, and then it goes to somebody else. And if the team on the ground is very lucky, down the road, 6 months later, they will get something processed to them. I think we need to either invest in the capacity building on the ground, or we need to invest in like as a community in a tool or tools that can actually allow people to like process the qualitative data as they collect it or immediately after, so they can have on hand the results that we have 6 months, 12 months later. I think that will allow us to do the power, and then potentially also to bring it together in some aggregated form in our reporting. So that's my qualitative piece. And the second part, I think our big learning is that there is something I would like to call a donor blindness. It's not an official term, but that's something that I would like to raise. Our colleagues on the ground are terrified by the donors' requirements. They believe that the donors' requirements is something that has to be fulfilled no matter what pandemic or other like emergencies are happening. And we tell them, no, we can discuss. The donor is open, we can discuss. They don't believe us. They don't believe us because they were trained and over that what is the requirement has to be fulfilled. So I would love to have some kind of more communication that goes all the way, the chain from, again, the donor through the implementing partners, all the way to the ground teams and the communities, that we are open to the discussion. And I'm afraid this has to be in writing, and this has to be in some very easily digest, like a way of communication, so we can actually open the discussion and not just be building on fears. Because what we've seen, that people were like straight diving into data collection in the midst of COVID, potentially risking spreading the COVID and putting lives in the danger just to get those results for my reporting, because what would happen if I wouldn't provide them, no matter how much we told them that it's not necessary, and we can figure out this later. I think like we have to be really careful about the power we have in the whole chain of demanding, and because there is a history of demand, we know it's really hard to shift it. So I think we have to be proactive and not just say, you don't have to do it, we can find alternative.
Thank you, Jakob. I hear a lot of parallels there to Tanya's question about capacity around RBM and the role of local Canadian organizations working with our local partners. How are we communicating this as that kind of main point of contact, and how can we leverage that more effectively? Lu-Wei, please share your thoughts on these pieces and what you've seen work on your side.
Yeah, I mean, quickly, as part of the evaluation also in Mali, we are about to collect qualitative data. So the issue was how to do it remotely. First, we work in excess of 700 villages in rural Mali. First thing we did was to map phone coverage of those 700 villages. And it was pleasantly surprising to see 80% of those villages have coverage. So that shows the potential now today with the technology. And our consultants are sitting between Montreal and Quebec City and some in Bamako. We don't need to be in the communities to do this qualitative data. The limitation here and the challenges is that by going to the community, of course, you will be part of the environment, you will have the observations, you will be physically face-to-face. We are missing on that. We are missing on the body language. We are missing on that. We were talking to a colleague of mine, and she says, often you ask a question in a qualitative interview and you see silence in the room because nobody wants to start answering. Nobody wants to be the first person. And that itself, it's a finding. By having an individual call, we are missing on the what's called focus group discussion. So we have no more group and we have no more discussion. It's going to be between one and one. It's still good, it's still valuable, but this is the limitations that we are talking about. So in a group discussion, we talk to 8 people on average for an hour. So you have the content of an hour whereby you can transcribe and put it digitally, and you use a software to analyze it. So you have a group of men, a group of women, adolescent men, boys, girls, volunteers, community health workers, and so forth. To do it individually, you are cutting on the sample size because there's no way that we could replace a group of 8 in 1 hour with 8 hours of individual call. Nobody would last an hour over the phone. So here is how to prioritize your question, how to sample, where to sample from. We spend more than a month and a half on the sampling size only. And how to triangulate, again, the doses from different sides of the projects. So we can have a case whereby several doses are coming from different parties, whereby a place where, let's say, Men Engage Alliance was not there, or somebody else was not there, so that we can have some meaningful qualitative, not in a quantitative manner, like we cannot quantify it. But here there's potential and there's limitation. At the same time, we might have some positive result by talking individually to someone where that person won't be comfortable talking about her or his opinion in a group. So by what we are saying here, we see potential, especially with the technology. And you put the money and the efforts and the quality of people that you use, I think we will get some good findings. It's possible. We are looking at, it's a challenging thing. And we passed the time of venting and being upset why we are not able to do a coverage survey to the time where how can we innovate? How can we use it as an opportunity because this could apply tomorrow, not to a pandemic necessarily, in a place where security changes and you cannot have coverage survey. And we work in places where security is an issue.
Absolutely. Thank you, Lue. We're close to time, but Jen, knowing your background in qualitative measurement as well, would just love to bring you in for the final word on this or any other kind of lessons learned that you're reflecting on.
Thanks. I think from metrics perspective, COVID has reminded us that the data is important. The data monitoring systems are important, and investing in them is important. So that's that, and people actually understand that. I think Canadians understand that. We have a better understanding of what data looks like and what it can do. I think this has provided great opportunities for us to innovate in the field of metrics. It's forced us to think outside the box, and these mixed methods approaches that are much more relevant for our in-country partners have been critical and should inform us going forward in terms of how we measure progress on projects and programs. And the idea of localization and using the capacity that we now all know is on the ground, and in fact actually tells us more about the impact, which is relevant, and what people on the ground think is success looks like, ultimately needs to be integrated into our evaluations. And I'm very glad that Global Affairs has been open to conversations, and that the opportunity to meet with our M&E teams virtually has opened the doors for more open conversation and less of that fear, and perhaps new ways of doing business. So I think those are some of the take-home points that I've had from the lessons that we've learned.
Thank you so much, Jen. It is, on this 1 year kind of milestone moment, it's clear that there's so much more that we need to explore, that there's a lot of learning and potential for real fundamental shifts. And I heard in each of our presenters some very specific and tangible examples of shifts that we can make, both in orientations and mindsets, but in also tactical approaches. And I have a list of notes here of conversations that we're going to be following up on. I want to just close by expressing my gratitude to Jen Brenner, Bart Dickinson, Lue Basil, Jakob Nemec, and Tanya Travers, members of our metrics working group, for taking the time, as well as a shout out to our other metrics working group members who are here on the call for their great contributions. I believe everyone here has my email or is able to access it in the invitation. But if not, I'll insert it in the chat. Please reach out to me and let me know if you would like to participate in some ongoing conversations on some of these particular topics, or engage more with members of our metrics working group. I really see that the next 365 days for us are going to involve a very deep exploration of these issues, along, of course, with the expertise of these 5 folks and all of the others in this virtual room and beyond. Thank you all again for taking the time with us today. Wishing you a good day, and I look forward to chatting with all of you soon.